Hi, everybody. Thanks for inviting me to speak today about cleaning and surface disinfection in the outpatient setting. I'd like to also thank Metrex and Scripps for sponsoring this webinar. It's great when companies get together to provide continuing education. So some of the things we'll talk about are the minimum standards of care in an outpatient setting, how microorganisms are transmitted, the relationship between cleaning, surface disinfection, and organism transmission, disinfectants, what they are and why we need them and how to select them. So let's get started. Now, outpatient care is defined as care provided in facilities where patients don't stay overnight, and that's all of your facilities in general. Compared to inpatient acute care settings, outpatient settings have traditionally lacked the infrastructure and the resources to support an infection prevention and control program or perform surveillance activities. Now, data describing risks for healthcare associated infections, which are infections people get while receiving healthcare for other conditions, are missing for most outpatient settings. But outbreaks from bacteria, viruses, and parasites have been occasionally reported. Now, most outbreaks and other adverse events in outpatient settings are associated with breakdowns in basic infection prevention procedures like inadequate cleaning and disinfection, poor hand hygiene, and poor respiratory hygiene or cough etiquette. Things like rhinovirus, which is what causes the common cold, influenza, respiratory syncytial virus, RSV, and of course, COVID-19 are what's common this time of year. Are you noticing an uptick in these seasonal viruses among clients and staff? Now, according to the CDC, all healthcare settings, regardless of the level of care provided, must make infection prevention a priority and must be equipped to observe standard precautions. Now, if you haven't already, I recommend you familiarize yourself with the Guide to Infection Prevention for Outpatient Settings, the minimum expectations for safe care, and its companion checklist too. It's Appendix A. It's the Outpatient Settings Infection Control Assessment Tools. Now, these are intended for use by anyone needing information about general infection prevention measures in outpatient settings. And they're based mainly on elements of standard precautions, and they represent the minimum infection prevention expectations for safe care in outpatient settings. Now, they address the 13 categories that are listed on this slide. I'm not going to read them all to you. Now, all of these might not apply to your practice, but things like healthcare provider safety, PPE, that's personal protective equipment, hand hygiene, cleaning and disinfection, and respiratory hygiene, cough etiquette probably do apply. Now, in the chiropractic setting, injection safety may be included too, and more so if your chiropractic practice, that's a tongue twister, performs any minor surgery. Now, chiropractic, PT, rehab, and massage have grown to become frequent providers of outpatient care for a variety of conditions, and all are traditionally a hands-on profession. So by the very nature of the procedures that you provide, there is hand-to-patient contact. Now, since these outpatient practices require that hands-on approach, it's important to be aware that all people potentially harbor infectious microorganisms. So we need to assume that all blood and body fluids or substances are potentially infectious. Now, in addition to following the OSHA Occupational Safety and Health Administration, standards for exposure to bloodborne pathogens, standard precautions are the minimum infection prevention and control practices that must be used for all of your patients or clients in all situations to minimize or eliminate the risk of transmission of infection, particularly those caused by the bloodborne pathogens. Now, bloodborne pathogens are infectious microorganisms in human blood that can cause disease in humans. Now, the three most common are the viruses that cause hepatitis B, hepatitis C, and human immunodeficiency virus, or HIV. Now, standard precautions must be used in the handling of blood, including dried blood, all other body fluids or substances except sweat, regardless of whether they contain visible blood, non-intact skin, and mucous membranes. And mucous membranes, as you probably all already know, Include the lips, the mouth, the throat, the nose, the ears, and the eyes. Now, standard precautions are designed to protect you, the healthcare provider, and prevent you from spreading infections to your patients or clients. Now, standard precautions consist of the following practices. There's hand hygiene, and that should be performed before and after all patient contact. Alcohol-based hand rub, that stuff that you get out of the dispenser, is absolutely acceptable unless your hands are visibly soiled or dirty. If that's the case, your hands being visibly soiled or dirty, you need to use soap and water. Now, I would consider offering alcohol-based hand rubs to your patients and clients prior to touching anything in your facility, or even soap and water if you have a designated sink where hand hygiene can be performed. Now, if staff are wearing gloves, you should perform hand hygiene before putting your gloves on and after removing them. And the reason after removing them is because gloves can have micro tears in them that you can't see. So there may be something on your hands that you don't know. So after you take those gloves off, hand hygiene. The use of personal protective equipment, or PPE, and that's gloves, gowns, masks, face shields, and eye protection if it's indicated. Now, train your staff to put it on and safely remove it. Respiratory hygiene and cough etiquette, especially during the cold and flu season. Train your staff to wear a mask if they're coughing or sneezing and they can't call off from work. Encourage your clients to also mask up if they're coughing or sneezing. All should cough into your elbow or cover your mouth, and all should perform hand hygiene after blowing your nose. And one thing to remember, if a mask becomes visibly soiled or wet, it's time to change it. When you remove it, handle it by those ear loops, then perform hand hygiene. You should ensure appropriate patient placement if that applies to your setting. So I worked in a hospital that also had a rehab unit within it, and patients were sometimes sent to rehab that were on precautions for certain bacteria, or they had open wounds that were covered, so they needed to be separated from other patients. Now, you can also use this approach, separating patients, for any patients or clients that show up that are ill at your facility. So consider separating them from others if they're experiencing things like diarrhea, vomiting, an unexplained rash, fever, or respiratory symptoms. But even better, try not to schedule care for anyone that's ill unless they absolutely must receive that treatment. And maybe ask a general screening question. Are you feeling well today? So consider scheduling those ill patients or clients at the end of the day so you can clean and disinfect properly. Routine cleaning and disinfection of the care environment, equipment, and devices. Shared equipment should be cleaned and disinfected between each patient or client with an EPA-registered hospital-grade disinfectant. These products are vetted by the EPA for effectiveness against a broad range of organisms, including bacteria, viruses, and fungi. And we'll learn a little more about this later on. Make sure you have appropriate handling of linens. Those are the towels, sheets, pillowcases, and other linens, and they should be changed after every patient or client. And one thing, I've seen this time and again, please don't wad these things up against your uniform or clothes because you could contaminate yourself. And I've seen bed bugs and scabies spread this way. Now, in the chiropractic setting, you should use and dispose of sharps appropriately. Remember, it's one needle, one patient. You should also use aseptic technique and appropriate skin disinfectants for procedures like acupuncture, dry needling, trigger point, and any other injections. But for this presentation, the focus is on proper handling, cleaning, and disinfection of patient-client equipment and cleaning and disinfection of the care environment. So cleaning and disinfection can really help keep healthcare providers and their clients safe. Appropriate cleaning and disinfection of equipment and surfaces can help prevent those avoidable infections acquired during healthcare delivery, and they help stop the spread of antimicrobial resistance. So how do surfaces transmit organisms? Well, surfaces can become contaminated with microorganisms and potential pathogens from you and your clients. Everyone that enters a healthcare facility has the potential to contribute just a little bit of themselves to the environment. It's sort of a creepy thought, but it's absolutely true. So this transfer of pathogens from these environmental surfaces is really due to hand contact with that surface. So it's hands touching doorknobs, treatment tables, head cradles, armrests, exercise, and other equipment. These can serve as pathways to infection. So touching a contaminated surface can lead to cross-contamination of patient care items, other environmental surfaces, self-contamination, and possible infection if you touch your face, mouth, or eyes, those mucous membranes. So once you touch those contaminated surfaces and don't clean your hands, you can spread those organisms to other items, other people, and even yourself. Now, cleaning and surface disinfection is even more important when hand hygiene compliance isn't at its best. Now, the hand hygiene compliance rate in the acute care sector, according to the CDC, is about 48%. So less than half of the time do acute care providers clean their hands when they need to. In the outpatient setting, I have to tell you, it's anyone's guess. So what is a disinfectant? It's a chemical that destroys or inactivates bacteria, fungi, and viruses, but not necessarily spores on inanimate surfaces. And surface disinfection is a way to inactivate pathogens on those hard, non-porous surfaces. So along with hand hygiene, surface disinfection is one of the most important measures in healthcare to limit the transmission of pathogens. And as we've learned, contamination occurs from either that direct patient contact, touching them directly, or indirectly from touching contaminated surfaces. So improving surface disinfection can contribute to a reduction in the spread of organisms. Okay, if I could see you, I'd say let's show hands, but how many of you know that the EPA classifies disinfectants as antimicrobial pesticides? Sort of surprising, right? So the EPA divides disinfectant products into two major types. We have our general use disinfectants, which you use in your household or if you have a swimming pool or for water purification systems. Then we have our hospital disinfectants, which is used in healthcare, including outpatient settings and dental settings. So hospital disinfectants are what we're talking about today. Now, the EPA considers a disinfectant to be a hospital disinfectant when it destroys or irreversibly inactivates infectious or other undesirable organisms, but not necessarily spores. Now, EPA registered hospital disinfectants must have demonstrated acceptable efficacy against three qualifying bacteria. It's Pseudomonas aeruginosa, which is a gram-negative, Staphylococcus aureus, which is a gram-positive, and Salmonella enterica, which is also another gram-negative. Now, EPA-registered disinfectants are what you should be using in your outpatient care setting because they have a proven spectrum of efficacy against organisms that you might encounter. Non-hospital disinfectants may not be as effective or tightly regulated. So please don't purchase or use products from places like the dollar store or Costco. Some of you laugh, but I've seen it, unless they are EPA-registered hospital disinfectants. One other important thing to note is that disinfectants used in healthcare environments, including the outpatient setting, are only part of a comprehensive, multi-tiered infection control program. Don't simply rely on that disinfectant to get the job done. Make it part of a robust cleaning and disinfection program along with hand hygiene. And speaking of cleaning, one very important part of your environmental infection control program should be cleaning. The definition of cleaning is the removal of visible soil and organic contamination from a device or environmental surface using the physical action of scrubbing. Now, cleaning alone removes large numbers of microorganisms from surfaces and must always occur before disinfection. Cleaning should include that mechanical action of scrubbing or elbow grease. And it's hard work, but probably as important, if not more so, than any antimicrobial effect of the disinfectant. So cleaning with mechanical scrubbing leads to better disinfection because now that disinfectant can touch the surface of the item you're trying to disinfect. So if a safe environment for your patients, clients, and staff is your goal, focus on cleaning, then disinfection, because cleaning removes the crud, so disinfectants can kill the organisms. Now, hands are what make organisms mobile. Organisms can survive on surfaces for long periods of time. And if you look at this slide, you can see their survival times. For example, E. coli, they're bacteria that are found in the environment, food, and intestines of people and animals. And although most strains of E. coli are harmless, others can make you sick. So you've probably heard about E. coli. It's a causative organism of many diarrheal illnesses, including traveler's diarrhea and dysentery. And sometimes you'll see alerts about food poisoning that the causative organism is E. coli. So it's a bug that you don't want to have in your facility because it can lead to illness to others. Now, a 2008 study of 36 acute care hospitals, this is acute care now, found that less than half of all environmental surfaces were properly cleaned. So if acute care can't get it done, how thoroughly are the surfaces and equipment in your facility cleaned? So more than 30 years ago, Earl H. Spalding devised a rational approach to disinfection and sterilization of patient care items and equipment, and we still use it today. Spalding believed disinfection could be more easily understood if instruments and items for patient care were categorized according to the degree of risk for infection when you're using them. So the Spalding classification system has 3 categories based on risk of infection. The first is critical, and these are items that contact sterile areas of the body or the bloodstream. Then we have semi-critical, which contact mucous membranes, those lips, eyes, mouth, etc., or non-intact skin. And then we have non-critical, which contact intact skin. So environmental surfaces fall under the non-critical category because they encounter intact skin. And our focus today will be on non-critical patient care items and surfaces. Now, this slide shows organisms and their resistance to disinfectants. And you can see that different groups of organisms vary in their susceptibility to disinfectants, and they're grouped accordingly in this pyramid. At the tippy top are the prions and bacterial spores because those are the most resistant, followed by mycobacteria, which is the bacteria that causes tuberculosis. And you work your way down all the way to the envelope viruses, which are the easiest to kill. Now, one thing I wanted to point out is efficacy claims against mycobacteria, the organism that causes TB, qualify disinfectants as intermediate level disinfectants. And you can see that on the slide. Those without that TB claim are classified as low-level disinfectants. And you're probably wondering, well, what does this matter? So that tuberculocidal claim has nothing to do with the transmission of this organism, but it's used as a measure of potency by the EPA. Mycobacteria have the highest level of resistance, except for those spores and prions. So any surface disinfectant with that tuberculocidal claim on the label is considered capable of inactivating a broad spectrum of pathogens. And you can see by looking at the slide, the intermediate levels take care of mycobacteria all the way down. That low level takes care of just the last 3 groups. So it's this broad spectrum capability that's the basis for using tuberculocidal chemicals for surface disinfection. And this is sort of an important consideration because no one knows what organisms reside on equipment or surfaces, right? So an intermediate level disinfectant might provide peace of mind knowing you're eliminating a whole bunch of organisms that could be transmitted by contaminated surfaces. This is a summary of that Spalding system and the pyramid. The main takeaway is that low-level disinfectants are used when there is no visible blood present, and intermediate-level disinfectants are used when visible blood is present. But just to get you thinking, there's something to note in the 2016 CDC isolation guidelines and OSHA. They recommend the use of an intermediate-level disinfectant, that one with the TB claim, when blood and or body fluids, secretions or excretions are likely to be present. Now, I don't know about you, but I can't see microscopic particles. And aren't blood and or body fluids, secretions or excretions likely to be present just about any place clients are or on anything they touch in a healthcare facility? So as an IP, I'm all about prevention. So I'd select the product with the broadest coverage so I know I'm killing everything, whether I can see it or not. Okay, because there are so many disinfectant products available, it's important to have a basic understanding of disinfection chemistry. See if I can get this to advance. This slide shows some of the more common disinfectant chemistries. The icons indicate their use. I'm not going to go through the whole slide, but I want to mention some of the most common. First one is alcohol. Then we have our halogen releasing products, which are bleach. And we have our peroxygens, which are hydrogen peroxide, and our quaternary ammonium salts, which are our quat products. Okay, so when you're selecting a disinfectant, it's important to understand the pros and cons of the different chemistries. Hang on one second here. All right, so the quat high alcohol, it has a broad spectrum of activity. It's fast acting. It is non-corrosive. It's non-sporicidal. And although alcohol is an excellent disinfectant, it is a terrible cleaner. High alcohol can actually fix proteins like blood to surfaces, making them more difficult to clean. Alcohol can also evaporate quickly, sometimes even faster than the listed contact time. Alcohol is flammable and it can be irritative. Then we have our quat low alcohols. These are broad spectrum. They're good cleaners. They have a mild chemistry. They are non-sporicidal, and you'll find them with various contact times, anywhere from 1 minute all the way up to 10 minutes. Then we have our quat alcohol-free. These are good cleaners. They have a mild chemistry. They are non-sporicidal, and they have limited efficacy. And the reason for that is because quat alcohol-free means that there's just a quat in there. And although quats are good cleaners, they don't have a broad spectrum of bacterial activity. So they need something else in there to give them that bump. Then we have our oxidation chemistry, which are halogens. Those are bleach products. They're fast acting. They're broad spectrum. They are sporicidal. Now, bleach is actually a poor cleaner because it isn't a surface cleaner, but it's actually an oxidizing agent. And bleach reacts with surfaces and breaks chemical bonds to kill organisms. Oops. It can cause staining, irritation, and it can be corrosive. Peroxygens are those hydrogen peroxide compounds. They're fast acting. They have a broad spectrum of activity. They break down into environmentally friendly products like water and oxygen. They can be unstable, and their effectiveness decreases at low concentrations, so high concentrations are needed. And they can have an unpleasant odor. Sometimes some people liken them to the smell of rotten eggs. So when you're selecting your disinfectant product, look for products that are good cleaners because the disinfectant must be able to touch the surface of what you're trying to disinfect. And if it can't, then the surface isn't properly disinfected. Now, there are a wide variety of disinfectants that offer a range of characteristics. So it's important to understand them when selecting the disinfectant that's right for your facility. So these are a few properties that I consider key when I'm evaluating a disinfectant. Sorry, I have a cold. Okay, broad spectrum. The disinfectant should be effective against a wide antimicrobial spectrum. Those outpatient facilities that provide care for patients that move between maybe acute care and your facility should consider using products that include kill claims for the pathogens that are the common causes of HAI. Also include organisms responsible for outbreaks and pathogens unique to your facility if you've experienced anything, and consider that intermediate level grade disinfectant, that one with a TB claim, for the biggest bang for the buck. And also think about the future and consider products with the emerging viral pathogens claim. And I'll talk about that in the next slide. The next thing is contact time. And contact time is the amount of time a disinfectant needs to sit on the surface without being wiped away or disturbed to effectively kill bacteria. No facility likes to keep clients waiting, so consider a product with a reasonable contact time that fits into your workflow. Fast contact times are important because they provide a level of confidence that you're killing the most common organisms before that disinfectant can dry or be removed, and before clients or staff can retouch that surface. Understand that contact times can vary even within a product. For example, a product might say it has a 1-minute contact time, but for an organism like TB, it could be 5 minutes. Now, this is due to the chemistry of the product and the need for a longer contact time to kill a resistant organism like TB. So look for a product with a universal contact time, which means one time to kill everything listed on the label. And read those label claims and contact times carefully. Okay, your disinfectant should remain wet, should keep surfaces wet long enough to meet listed contact times with a single application. And this can sometimes be an issue with high alcohol products. Sometimes they evaporate more quickly than the contact time, so keep an eye out for that. Safety. Your product should be non-toxic. It shouldn't be harmful or irritating. It shouldn't cause allergic reactions, especially asthma and dermatitis. So you want to look at those signal words for that toxicity rating. The highest toxicity is danger, and then they go down with warning, caution, and no signal word. Flammability. Choose a product with the lowest flammability rating. Nobody wants a fire in their facility. PPE, personal protective equipment. Most facilities prefer a product that requires the least amount of PPE, but it still provides protection from exposure to adverse health effects to the staff. So read that label carefully to determine if special handling and storage are also indicated. Surface compatibility. Your product should not corrode instruments and metallic surfaces, and it shouldn't cause deterioration of healthcare materials. Also look at the pH. I prefer products that have a neutral pH because I think they're sort of kinder and gentler to the surfaces and equipment I'm trying to disinfect. Easy to use. Frankly, the easier a product is to use, the more likely it is for staff to achieve compliance and thoroughly apply that disinfectant to all those hand contact surfaces. It should have clear, easy to follow directions. Odor. Look for either an acceptable odor by users and patients or no odor. A good example of this is bleach. Some people love it, other people hate it. Cleaner. Your product should have good cleaning properties. Remember, you can't adequately disinfect the surface if it hasn't been thoroughly cleaned. And you'll find certain products have chemical ingredients that do a better cleaning job than others. But in addition to considering the chemical ingredients, when you're looking at disinfectant wipes, also consider how well that actual substrate material, the wipe itself, cleans, because the ability to clean is as important as the disinfectant. Okay, so back to that emerging viral pathogens claim. So when COVID first appeared, we didn't know much about it, especially what can be used to appropriately disinfect potentially contaminated surfaces. We had no products that had label claims stating they were effective against it. So for this reason, the EPA, Environmental Protection Agency, created the emerging viral pathogens claim. And it's triggered by the EPA in novel or outbreak situations like COVID or monkeypox. It allows disinfectant manufacturers that have submitted data to the EPA demonstrating efficacy against difficult to inactivate viruses to allow you to be able to use their product against viruses that are not on the product label. So select a surface disinfectant that qualifies for that emerging viral pathogens claim. This can help you prepare for the future next big thing, because we all know this isn't our last pandemic. Now, a little bit about disinfectants, liquids versus wipes. So it's not too surprising that the spray system and the cloth are often what's used to clean and disinfect in outpatient settings. They typically cost less than disinfectant wipes, but they aren't necessarily the best method to keep patients, clients, and staff safe. Oftentimes, the disinfectant is sprayed onto a surface that hasn't been cleaned, so the disinfectant can't penetrate the surface to do its job. Now, some things to consider with sprays. Price. Yes, they can cost less. Effectiveness. Mixing. If the product requires mixing of chemicals, you need to train your staff how to do this correctly so the effectiveness of the disinfectant is accurate. Safety. Personal protective equipment. If you're mixing chemicals and not wearing appropriate PPE during mixing, you could put yourself at risk for a chemical exposure to your skin, eyes, or respiratory tract. Inhalation. There's also the risk of inhaling chemicals that are released into the air when you use that spray disinfectant. Ease of use. A spray requires supplies. You'll need a spray bottle and multiple clean cloths. Consistency, and this is a big one. Maybe one staff member sprays that cloth 2 times while another sprays it more, or maybe even less. So this potential inconsistency could impact disinfection. Contact time. You've already sprayed and now you're wiping with another cloth too soon prior to that designated contact time, rather than letting that product air dry. And this can reduce the effectiveness of the disinfectant. Care of surface and equipment. There's a correct and an incorrect way to disinfect surfaces or equipment. And if users aren't trained for this, repeatedly spraying a liquid on the surface can lead to expensive repairs or permanent damage. Disinfectants should always be sprayed onto a cloth and not directly on a surface. Now, you may leave a paper residue. When a spray bottle is combined with paper towels, and some places do this, it can leave a paper residue. And this can lead to additional work to remove that paper. This can also have negative consequences on the effect of the disinfectant if that paper residue isn't removed. Safety. Hazardous chemicals in the air. The use of a spray can release chemicals into the air, which may increase the risk of health problems, not just for the user, but also for anyone else nearby that might be sensitive to that aerosol. Appearance. The bottles can leak and sprayers can stop working. I don't know why, but every time I use my Windex thing, it eventually quits spraying. Now, disinfectant wipes. Price. Yes, they can cost more. Effectiveness. They always have the right disinfectant ratio, so there's no variability in the effectiveness. Safety. Disinfectant wipes are designed to eliminate the risk of harmful chemicals being released and inhaled by the user, as can happen with a spray. Ease of use. Wipes come in one convenient, ready-to-use package, no additional supplies needed. Those wipes are already impregnated with the correct ratio of active ingredients, so that disinfectant works exactly as it's formulated with no mixing errors or incorrect spray. No incorrect spray volumes, okay? You take a wipe, you use it, you throw it away, you're done. Appearance. They're available in canisters that close tightly, preventing wipes from drying out. They can be wall hung or placed wherever needed. They're visually available, so it's a visual cue to use them, and they take up minimum space. So disinfectant wipes are a modern disinfection solution. They demonstrate the same power as the spray, but without the limitations. And they even come in wipes that clean and disinfect in one step. There are also numerous studies that mention the inhalation risk from disinfectant sprays. This is one. So carefully consider which method you're going to use. And remember, price is only one consideration. Now, maybe you've all used wipes, but if you haven't, this is how you use a disinfectant wipe correctly. And I mentioned there are one-step wipes and two-step wipes. So a one-step wipe is a cleaner and disinfectant all in one. And the way you use these is you take your wipe out of the canister. If there is no visible soil present, you simply wipe that surface. And while you're scrubbing, you're cleaning, and you're also laying down the disinfectant. You then throw that wipe away, and you allow that treated surface to remain wet for whatever that designated contact time is. and you let it air dry. Now, two-step disinfectant wipes are, they require a clean and then a disinfectant. So if you have a two-step wipe, you'll take a wipe and you will clean whether you see anything there or not. You will throw that wipe away. You will take another wipe. Then you will unfold that wipe and thoroughly wet the surface with that disinfectant. And now starts the clock on your contact time. You allow that treated surface to remain wet, and then you let it air dry. But one thing to understand, if there is visible soil present, any one-step cleaner disinfectant becomes a two-step because you must clean first per the Centers for Disease Control. Now, this is a generic set of instructions on how to use a disinfectant spray. Obviously, a manufacturer will have more detailed information, but I just wanted to kind of go through this a little bit for you. You should always follow the manufacturer's instructions for use. And they generally go like this: check that your product is an EPA registered hospital disinfectant because you are in an outpatient setting. You want to read and follow the manufacturer's instructions for use. Wear personal protective equipment if it's indicated. You're going to pre-clean that surface if you're directed to do so. You'll hold the spray whatever that distance is from the cloth. You'll spray that cloth however many times they tell you to do it. You're going to wipe that surface with the cloth. You're going to leave that solution on the surface for the indicated contact time. Allow it to air dry. Don't wipe it dry. And if you're wearing gloves, you would remove and discard them, and you're going to perform hand hygiene. Pretty simple, but a lot more steps than a wipe. So we're going to go through some recommendations for cleaning and disinfection of surfaces and equipment. So outpatient facilities should establish policies and procedures for routine cleaning and disinfection of environmental surfaces and equipment as part of their infection prevention plan. I hope you all have something. Facility policies and procedures, they should address prompt and appropriate cleaning and decontamination of spills of blood or other potentially infectious materials. Say somebody vomits in your facility, and how you contain, transport, and handle equipment that might have been contaminated. The policies and procedures should include assigned responsibility for routine cleaning and disinfection of environmental surfaces and that shared equipment to appropriately trained healthcare providers. Training should include the required cleaning and disinfection steps and the appropriate PPE necessary for handling of contaminated equipment. Remember those standard precautions. Competencies of care providers responsible for cleaning and disinfection of equipment and devices should be documented initially upon assignment of those duties, annually, and whenever new devices or disinfectant products are introduced or policies and procedures change. So it's not a one and done, it's a continuous process. Emphasis for cleaning and disinfection should be placed on surfaces and equipment that are most likely to become contaminated with pathogens, especially those that are near the client and those frequently touched surfaces and equipment in that nearby client care environment. That would be your treatment tables, shared exercise equipment, things like that. The cleaning procedures should be periodically monitored or assessed to ensure they're followed consistently and performed correctly. Now, EPA registered disinfectants with label claims for use in healthcare should be selected for disinfection. Care providers should follow manufacturers' recommendations for use of the products that are selected, paying attention to the amount, if there's a dilution needed, the contact time, safe use, and disposal, just to name a few things. So this environmental cleaning checklist can be modified for your facility. The nice thing about checklists is they help ensure that the facility infection prevention policies, procedures, and supplies are in place and being followed by care providers to provide safe care. They assess personnel adherence to correct practices by direct observation during the performance of their duties. So someone can be just walking around with this and seeing that John's wiping down something after somebody just used it. It's really, they're pretty handy. And they have a section to record comments or corrective action. And this can provide a history of compliance or non-compliance. So they're quite easy to use and handy. This is another checklist you can modify and use to help with assessment of cleaning and disinfection of equipment and medical devices. Your facility should have policies and procedures to assure that reusable equipment is cleaned and disinfected appropriately prior to use on another patient. All shared medical equipment should be cleaned and maintained according to the manufacturer's instructions to prevent patient-to-patient transmission of pathogens or contaminants. Cleaning to remove organic material must always precede disinfection because residual debris reduces the effectiveness of the disinfection process. So cleaning comes before disinfection. You all know that now. Okay, in the typical outpatient setting that you're in, rehab, PT, chiropractic, and massage, hand-to-patient skin contact occurs frequently throughout the day. It's what you're known for, right? Hands-on. It's unknown how frequently, though, pathogenic organisms are transmitted between providers and their clients or patients, because clients or patients are unlikely to report contact with their care provider as a source of infection. Now, researchers have found that treatment tables often test positive for bacterial contaminants or pathogenic microbes, including methicillin-resistant Staph aureus. You've probably all heard of MRSA. Now, this should be concerning for any care provider who's serious about protecting their clients from infections and other health issues. Now, most treatment tables include a face piece where clients place their faces, makes sense, during each treatment session. And that face cradle is where makeup, skin secretions, and possibly discharge from the nose or mouth may be left on the table. To keep this part and other parts of the table clean, experts not only recommend using table and face paper, but changing the paper after every single session and performing direct surface disinfection underneath that paper, allowing the surface to air dry. And remember, the drying process is part of the disinfection process. So don't wipe it dry, allow it to air dry. Now, fortunately, by developing a standard routine for disinfecting the treatment tables in your practice, you should be able to dramatically reduce contamination and the risk of infection. Are your treatment tables clean? So, according to the Center for Disease Control and Prevention, all healthcare settings must make infection prevention a priority and must be equipped to observe standard precautions. I recommend the Guide to Infection Prevention for Outpatient Settings, Minimum Expectations for Safe Care. You could use that to help develop policies and procedures or just as a reference. Also, tailor that Appendix A, that's the checklist to ensure your facility has appropriate infection prevention policies, procedures, and supplies in place to allow your healthcare providers to provide safe care. In addition to hand hygiene, and hand hygiene is really important, focus on cleaning and disinfection of medical devices, shared patient equipment, and the patient environment. That treatment table and all of its parts should be on your radar. Select a surface disinfectant that has a broad spectrum of efficacy, has a fast universal contact time, and you all know what that is now, is a good cleaner because cleaning is important if you want disinfection, easy to use, and is compatible with your equipment and surfaces. So by following this guidance, you can help assure your facility isn't a source of contamination or infection to your patients, clients, and staff. These are some resources. I really do recommend you at least take a look at the first one and see if the Appendix A checklist can be tweaked to work for your facility. And then there's another observation tool for ambulatory care, which you might also find useful. Thank you so much for your time and attention.